whether the obstruction is in the big tubes, mid-sized tubes, small tubes, and more importantly, which kind of medication is capable of opening or relieving this spasm. When we say spasm, so this is a model just to show what is the meaning of spasm. This is a normal looking air tube. It is not constricted. These are muscles which are running around the air tubes. This is the normal situation. In an asthmatic, it becomes like this. There is inflammation in the inner lining of the air tubes. This is the first thing to happen. It releases certain chemicals which causes constriction of these muscles and causes phlegm production. So basically, we are talking about three things. One, inflammation. One, constriction. And lastly, phlegm getting stuck. All of these together cause difficulty in the free flow of air. So this is the meaning of constriction, obstruction, etc. So we have talked about spirometry. There are certain other tests also which a doctor would like to do. These are very simple blood tests like TLC, DLC, absolute eosinophilic count. They tell us the extent or the number of eosinophils in the blood. Eosinophils are the cells which are related with allergy. In asthmatics, usually they are high in number. Then there is a test called immunoglobulin E or IgE, which tells us the genetic tendency about allergies. So these are some simple blood tests one would like to do. We would also like to do some sputum tests, some bulgum tests, to see the extent of eosinophilia which is in the sputum, which tells about the allergic inflammation going on in the air tubes and the level or lack of control of asthma. So this is one aspect of asthma diagnosis. Is it asthma? How severe is it? There's another third aspect about the diagnosis of asthma, and which is what are the reasons behind asthma? What are the causes behind this particular asthma? And that is best done by doing what is called an allergy test. That is a skin prick test or a skin intradermal test, in which the usual causes of allergy or usual causes of asthma, which are pollens, fungal spores, dust, danders, etc. These are one by one injected into the skin intradermally or pricked into the skin, and then a reaction is observed which usually occurs within 20 minutes or so, and it tells us for this particular patient what are the causes of allergy. For example, his allergy is caused by parthenium, which is congress grass, or prosopis, which is kikar, very very common in North India, house dust, cockroach, certain alternaria, certain fungi, etc. etc. Now, having found that out, then we can guide the patient how to avoid these things, because that is ultimately the treatment of any allergy. If you know what you're allergic to, you try to avoid those things. Certain things we find out would be avoidable, but certain things would not be. For example, if somebody is allergic to parthenium, for example, and he lives in Gurgaon, he's exposed to parthenium all the time. We cannot simply say that you now shift to America. So sometimes then we make the vaccine against those very things, which is given in increasing doses, and then the person slowly becomes desensitized or hyposensitized, which is called allergen specific immunotherapy. This we will discuss a little later in the treatment aspect of it. So this is about the confirmation of diagnosis of asthma. The next question is, how do we normally treat asthma? You see, my feeling is that any chronic disease, the word should not be treatment but management. It is not simply that the patient comes and the doctor will write a prescription and the patient will follow that and he will become all right. When we are talking of chronic diseases, be it asthma, be it diabetes, be it blood pressure, be it heart disease, it has to be managed in a very comprehensive sort of way. So what in my view are the important components of treatment? I think are 5. 1, right medicine, right dose, delivered at the right place. That is one component. Second component, patient education. You have to educate an asthma patient what causes his asthma, how to go about preventing it, what to do in these situations or that situations, so that in effect, with the help of the doctor, the patient becomes an expert in his own condition. He learns what causes his problem and he learns how to manage it. Third and related component to the second is partnership with the patient. The patient has to be supported through thick and thin by his doctor, who is not only knowledgeable but also compassionate. He has to become the friend of the patient, that I am there to help you, to guide you, But yes, you can do these things yourself. It should not become that the patient becomes too much dependent on the doctor, but the patient has to be self-reliant. So this is a partnership. That is number 3. Number 4, avoidance of allergy causing things. The patient has to be educated what causes allergy and how he has to avoid that. And the 5th is specific immunotherapy, allergy vaccination, giving them in increasing doses so that eventually the person becomes less sensitive or desensitized to these very things. Now let us come to them one by one. Let's first talk about medication. About 20 years ago or 30 years ago, when we were medical students and we were taught about asthma, we were taught that asthma is a disease in which there is spasm and you give a medicine which relieves the spasm, and that's the treatment of asthma. Now we know spasm is only one thing. Before spasm is this inflammation which occurs, which releases chemicals which cause constriction, but also releases hundreds of other chemicals which can permanently damage the air tubes. So simply relieving the spasm is just not good enough. We have to control the inflammation if we have to control the asthma and the bad consequences of uncontrolled asthma. So this is the difference in treatment now, and this kind of an inflammation is best controlled by inhaled corticosteroids. So how do we deliver the inhaled corticosteroids? Steroids are medicines, are hormones, which when given to a patient orally in the form of a tablet for a very long time can have side effects. So we cannot give like that. So we have to give them locally. It has to just go inside the air tubes, work over there and not enter the bloodstream. In the last 10 years or so, whatever advancements have been made in inhaled corticosteroids, they have been made in the line of not efficacy but safety. Efficacy means effective. We have very effective medicines. We are not looking for more effective medicines. We are looking at safer medicines, which means whatever goes inside should not be absorbed. It should just act locally.